Yes, she lived in her husband.
All right, we've started. This will get us going.
Like
And then I'll be back for anything else.
Awesome. Thank you so much.
You're welcome.
My brother saved that money. Oh, good. And I've got a trust fund.
It's not only here, it's all over everywhere.
She wants to be, I think she wants to be.
I guess I'll go ahead and jump in. I want to respect your guys' time here. We got the technology side figured out. We're recording the meeting so people who couldn't join can listen to me later, and I'm sure you guys can have it if you needed it. So now how can I make that go away? So that's not what you see. Hold on. Is there? You're okay. I guess that's better. Are you joining us? Welcome.
I'm supposed to be.
There's some snacks over there if you want some too.
Yes. I've been here sooner if I'd known.
Shut that so we can cut down on the noise. So welcome everyone. We're talking Medicare today. My name's Mallie Reeder and I am a Medicare specialist and I work for Insurance Management Group or IMGs here in town. So we're just up the road and we handle your benefits here at the county as well. And I'm just our Medicare specialist. So I don't work on the benefit side, but on the Medicare side, helping people with transitioning to Medicare or all things Medicare. So you have a copy of the presentation if you'd rather look at that, or you'll have it to take home with you so you don't have to write down every little word. But feel free to, of course. And I guess without further ado, I'll just jump in. I'll also say you have another little packet I'll reference later as well. So that will be forthcoming. Okay, hold on. For virtual, I'm muted. How do I unmute myself? There we go. Ooh, no, maybe I'm muted on purpose. I think he'll come back down here if it's messed up. He said he would watch the meeting for me. Let's assume it's recording. Okay, sorry. So maybe. Sorry again. Do I have to do this? I apologize, guys. I'm not used to this system here. Oh, now it's going. Okay, good. Hopefully we don't have that feedback the whole time. Sounds better now. Okay, apologies, guys, again. So my plan for today is to talk through all of the commonly asked questions. It really covers all the topics, but the things I always get asked from people, and first it's always, do I have to do this? When do I need to do it? How do I do it? What the heck's going on with all the parts? What's covered by everything? And what are the costs, of course? So those are the topics I'll go over. We'll hit on all the basics of Medicare, and then we'll have time for questions in the end. So happy to stay and chat with anyone as well. So the first question is, do you have to sign up for Medicare? Do you really need to do this? And the answer is different for everyone. It depends on your employer that you have and what coverage they're offering you. So today I'll tell you Grant County specific, the answer if you have Grant County's coverage. If you have coverage elsewhere, talk to me separately because it's going to be a different answer for each person. So this is really individualized based on what you have. So for Grant County, as long as you're actively working, you can stay on the plan as long as you'd like. Whenever you retire, it doesn't matter how old that is or whatever. If you're eligible for Medicare, you can decide that you want to move to it sooner than your retirement if you want to. So you can really go whichever way you want. You have that choice. It's really which way is going to be the most cost effective for you or which you might prefer for coverage reasons. So it's really your choice, again, as long as you're working. So the distinction here is if you're retired and you're on the plan because you're a retiree, that's a different bucket for the county. You do have to move to Medicare at that time. So you got to be or actively working. So before I move on, I'll say this answer is oversimplified because I know the benefits of the county. So just to go ahead and take the next step of saying, this is the reason this is because the county plan satisfies Medicare's penalties that they have. So that's always the fear. That's one question is, what are the penalties? What do you mean? Am I okay to do that? This is because I've checked those things already. So that's why you want to be careful if it's a different coverage situation that you have. So Medicare will exempt you from their penalties if you have good enough coverage elsewhere. So that's why the county plan is okay for you guys to do that with. And then you can transition to Medicare whenever the time comes for you. Okay, so then when do you do it? I'm getting less feedback over here, so I'm gonna stand over here, sorry. So the rule of thumb is 3 months prior to whenever you need the coverage to start for you. So it could be 3 months before your 65th birthday, perhaps, or 3 months before your targeted retirement date, whatever that is, just back up 3 months at least, as a minimum to start working on things. That's when you're close enough to that window that you can start applying for everything. So, and then once you're on Medicare, you can review and make changes during the open enrollment period, which we're in right now, coincidentally. So I would like to include this, throw that on there, that if you're not on Medicare yet, all the advertisements and everything, the deadline that you're hearing about right now is totally irrelevant to you. It's only for people that are already on Medicare. So don't worry about it. It causes people some stress of just seeing that deadline. It doesn't apply to you until you have Medicare plans and you want to review them. And then you can do that with your agent or whatever every year during that time frame. So, and then we have how to sign up. We sign up for original Medicare, the parts we get from the government through the Social Security Administration. So Medicare doesn't have offices throughout the country. It's Social Security administers it for Medicare. So you can apply in any of the ways that they make available to us. You can apply online at their website. It's the same Social Security account for all your Social Security benefits as well. So it's the same login. And you can apply on their website if you're at all comfortable with that. It's fairly easy. And they're kind of pushing everyone to do that. Doesn't mean you have to, but you do get quicker results that way. So I will say that at least. But you can also have a phone meeting with them or an in-person meeting, and their office is open again for walk-in business. So you could just walk in there one day. You just kind of risk sitting and waiting or whatever. So you can also make an in-person appointment too as an option. So that's how you sign up for the original parts of Medicare, which I'm going to get into what all the parts are here shortly. And then you still have to do some sort of insurance plans to go along with Medicare, the supplemental plans. So you've got to, I would say you got to have an agent, but some people try to do it on their own. You have to do at least something else other than just what the government gives us. So you have to do that after you do the basic enrollment first.
You're talking about Medicare Part A, the basic enrollment.
Part A and Part B are both original, what I would call original Medicare. They're the only parts or the two parts that we get from the government for Medicare. So yes, Part A. Part A is, I'll just fast forward and say the free part of Medicare. It's a $0 premium if you've worked and paid into Medicare taxes. So oftentimes people will know that one really well or have that one maybe because it doesn't cost them anything to have that, even if they're still working or something like that. So there's a lot of different scenarios and combinations of things you can do there. We're getting a little in the weeds, but Part B is also a part of it as well. So this is a good segue. That's the next slide here. We're just starting to get the intro of the different parts. Part A is hospital coverage, or I like to think inpatient. So anytime you're actually checked into a facility, you're an inpatient, it's going to flow through Part A. So of course that's the hospital, but it's also like a rehab stay for a week if you had to, you had surgery and you had to get better before you could go home type of thing. That would be covered there as well as another example for you. And then Part B is all of your doctor insurance or everything outpatient. So it's a much bigger bucket, literally everything outpatient. So it really makes up the rest of your medical care. So it's every doctor's appointment, all your labs, x-rays, ambulance rides, anything as an outpatient is going to flow through Part B. And that's all we get from the government for Medicare. And so you just have inpatient and outpatient coverage specifically. And that's, I think, one of the confusing parts about Medicare is how stripped down it is. That's truly all you get, exactly what it defines. There doesn't come with anything else. Number one, the top issue with that is prescription coverage. It's one of their penalties too. You have to at least satisfy creditable, they call it, good enough drug coverage once you're eligible for Medicare. So again, the county offers you that. That's one option, or Medicare plans as well. So
Medicare Part B, you pay into Part B, also, you have to buy Part B after eligibility, correct?
correct. It's not a $0 premium one.
Right.
And I have costs on another slide here later. Yeah. Just going to talk about benefits first and then give it the costs. But yes, you have to pay, goodness sakes, it's not liking me today. You have to pay Social Security for Part B.
Right.
And then your other options, goodness sakes, I'm sorry guys, I don't know what to do about that. Your other options, it's not going to work. Well, I think tech guy, if you're listening, can come down. I don't know. Keep on rocking, I guess. I don't know what to do. So the other plans, parts of Medicare, we have Part C. Those are your Advantage plans or replacement plans. I'll get into more details here in a second. We also have Part D. Those are your prescription plans. And I always think D for drugs, if that helps you with all the parts and keeping everything straight. Part D is just drug coverage. And then we have Medigap plans and Medicare supplements. So they don't have a part name to them, that they're just Medicare supplements and they get nicknamed Medigap plans. So that's one in the same there, and you can use whichever you want. Maybe it's the volume of the TV. Oh no, but the TV would have to be on. Let's see if that works. Okay. So. There we go. That's okay.
Hold the way for just a second. We just got to make use of here.
Try to turn volume down on the TV, just experimenting.
Yeah, we want to mute you, and then we use that there. All right, that should do the trick there. You want to give it a go? Did you do something with the TV remote too, or
It's
no?
right there somewhere.
All right, give it a go.
Okay. So this chart is on the other printout that you have. So if you want to look at it, it's larger. That is the second packet that I gave you. This is my favorite chart to sit and look at Medicare options with an individual. If we were having a meeting closer, one-on-one, I'd really mark this up. I love it because it shows you every single Medicare option out there, all on one chart. So I think what, really gets overwhelming and seems like hundreds of thousands of plan options you see advertised. We can simplify it in top categories first before we get into actual plans. And it's more important to understand what type of product we're talking about when it comes to Medicare. So these are these different categories. So you either end up on one side of the chart or the other. You've got to make some decisions, of course, at the end of the day. But first and foremost, I'm just adding a box around the original parts of Medicare there. You see Part A and Part B on both sides of the chart with the boxes checked. You have to do the original parts of Medicare first before you can start adding any of the other plans and parts as well. So everyone takes the same first initial steps, no matter what. You've got to do the parts through the government first and then add on to it. So it doesn't matter which way you're going, you do the same thing in the beginning. So we talked about what Part A and Part B are before. You see the little pictures here, if that's helpful. The hospital building for Part A, you've got to be an inpatient in a building, and B is the doctor's stethoscope there, your outpatient coverage. So that's all that we get from the government for Medicare is just Part A and Part B. So there's a couple of issues with it. We've started to hit on these already. The first problem is there's no pharmacy drug coverage anywhere yet. And you have to have it when you are eligible for Medicare. The government says from that point forward for the rest of your life, you have to maintain creditable drug coverage because you're eligible for Medicare. So you can do that in a number of ways, but we're going to talk about the Medicare options, of course. How you add it is how we get to the different options, the different sides of the chart here. So I'm going to go over the left side, first option first, and then we'll talk about the other side last. So on the left, what you do is keep original Medicare. You keep Part A and Part B, and all your claims run through the Medicare program that they give us, the government level, and you just add insurance policies onto it. So I think the confusing part is it's very piecemeal together. You have different pieces that you have that all work together to make up the whole package of what you need. So the confusing part is, I think you used to just have health insurance or you didn't. And it's a little more detailed on Medicare. You've got to know exactly what you have. So you get the regular parts from Medicare, and then we just add. So for the drug coverage, I'm just putting a little check mark in that box. You add a drug plan or Part D. So on this side of the chart, your drug plan is a standalone plan. It's its own little ID card that you have that's nothing but pharmacy drug coverage for you. So the plan that you choose is very driven by the drugs that you're on, your personal details. So everyone's different. Even two spouses might have different drug plans because their drug list is rarely the same, right? It could be the same plan if that's what you want or if that's the coincidental result, but it doesn't have to be. It's very individualized. So be careful here on comparing to what your neighbor has for their drug copays or your brother or sister or whatever it is. That's always a tricky one because everyone has a different drug list, a different pharmacy they like to use, and all those factors really matter, all the way down to whether the drug's a tablet or a capsule, believe it or not. So it's very individualized. So you have a drug plan and you pay a premium for that plan, and it just covers your prescriptions that you get from a pharmacy. And you're in working with an agent, that's really where we come in and take all those details from you and look at all of the plans you have to choose from and make a recommendation on what's going to be the best for you out there, taking into consideration all those data points that you have. So we want to recommend a plan that's not going to cause a disruption for you, of course. And then you still pay copays at the pharmacy when you pick up your drugs like you have before. Depends on the drug, what the copay is. There's so many different drugs today. You know, generics are pretty cheap or cheaper, I should say. It even depends on the drug in that category, but that's a good rule of thumb. You know, it could be a $0 copay sometimes, perhaps, but it goes up from there kind of limitlessly, depending on the brand name drug and how expensive that might be, et cetera. So again, an agent will be able to tell you exactly what those copays look like and really get into the nitty gritty with you, or I can give you a general idea afterwards as well. So that covers the drug coverage piece. Can't hear audio. Whatever. Okay, so the other problem with original Medicare, we talked about the drug coverage on the left so far. There's another issue with only having A and B. If you just took the government pieces and ran off in the sunset with it, you have to pay quite a lot in out-of-pocket costs with Medicare. So you have A and B from the government, and their saying is they cover 80%. You have to pay 20% of all your doctor bills and whatever comes up for your care with either part. It's a little more complicated than that. There's a deductible with each part, and then it's 20% after that. But it's an easy rule of thumb to say.
Still doing it?
I think so. It popped up something for me, but
It's gonna pop up almost about half an hour. See if you're still there, but I'm also remoted in and
okay.
I'm just trying to.
Thank you. That's okay. Appreciate your help. So the out-of-pocket cost, the 20% that you have to pay, the issue with that is that there's no stopping point to it. It's 20% of everything. There's no out-of-pocket maximum on Medicare. And that's the issue here. There is on your regular health insurance that you have. It's mandated in that market. So the problem with Medicare is it could be 20% of literally anything. It depends on how much the surgery costs. You pay 20% of everything. So that risk exposure is too high for most people, and that's where the Medicare supplement policy comes in. So drawing if it lets me, check mark there. Okay, it's not gonna let me, but I was just trying to add a check mark in this box in the bottom left and underline Medicare supplements, kind of hiding in that category or paragraph there. Its nickname's Medigap because what the Medicare supplement does is pay the gaps. So it goes right along, butts up against Medicare A and B and pays that 20% for you. So you have another insurance policy for that piece that you've got to get. There's different types of supplements out there, different companies to pick from and all of that. So again, an agent will help you hone in on exactly what that looks like, and we can get into it a little bit if you'd like. But the point of it is that you're paying for an insurance policy and offloading that risk to them. They pay all of that 20% for you, so it really doesn't matter to you anymore. Then it depends on the plan that you pick, what your out-of-pocket looks like. So the idea is that it's very low. You're paying a monthly premium to a company so that you have that peace of mind that your bills are capped very, very low for the year. Again, depending on the plan that you pick, there's some different plans. We open that up and there's, different options in there as well. Let's see. That's pretty much it for the left side on the things I wanted to hit on in summary. One of the weird parts about it, I think, is that you end up having 3 different ID cards. You got one from the government, one for your drug plan that you show the pharmacy, and one for your supplement plan you show with Medicare always everywhere else. You just have the one that goes to the pharmacy, and then 2 you'll show for everything else. So hopefully that makes sense. The drug plan will say prescription or RX or something on there on the card to help you signal it goes to the pharmacy. And you would always, if you stay on that side of the chart, have multiple cards and things. The beauty of it, I think, if we talk pros and cons, I try not to say the word advantage because we're going to get to that next, but the pros of this side of the chart is that you keep Medicare from the government. And that's good because that makes them the decision maker on all of your claims and not an insurance company. So who you have for your gap plan or your supplement plan is mandated by the government to pay those gaps based on the plan you've chosen. So they don't get involved in approving any claims at all. Medicare makes that decision and they just have to cut a check for the gap, if you will. So it's a beautiful thing on the left in that you don't have an insurance company to argue with about prior authorizations or, whatever those things are that we get annoyed with insurance about. You don't have on the left as much. Medicare still has criteria for stuff to be covered, but it's just that it's been the same for everyone. And Medicare is a federal program. So every person in the country gets the same thing for Medicare if you stay with the regular Medicare. So the big thing I'm getting at here is you have freedom of doctor choice on the left. That's a huge one. I would write real big on there. If it were me, I would write it up here because it compares so drastically with what we'll get to on the other side. Arguably one of the best parts about the left, since Medicare is the same all over the country, Medicare doesn't care where you go to the doctor. You could wake up, next week and drive yourself down to Texas and go to the best heart specialist because you read an article that they're the best. And Medicare doesn't care, as long as they'll send the bill to Medicare. I mean, doctors still have the choice. There's like a 2% chance you'll run into a provider that won't bill Medicare, but it is possible. As long as Medicare is billed, then your supplemental pay too. They just follow right along. They're kind of one and the same, if you will. They're married to each other, and that they cover everything the same way. So the question is always, will Medicare cover it? And if Medicare does, the supplement has to. So that's the beauty, one of the beautiful things about the first option there. So that is a nice segue to compare with the Medicare Advantage plans on the right side of the chart. So you also have the option of totally changing your path to Medicare and going with a replacement plan instead. And I like to use that word because I think it's a nice visual. It is what they're called really as well. Because what you do when you go to an Advantage plan instead is let go of Medicare. What we just talked about with having Medicare as your decision maker, you choose to let go of that and replace it with an Advantage plan instead. So, or a Part C, if that's what you want to call it, same thing. And they're all offered by private insurance companies. So you give, or you get, however you want to look at it, a plan from where the entire thing is wrapped up in one plan. And it's provided by an Anthem or a Humana, United Healthcare, whoever it is. That company that you pick provides you with the whole thing from A to Z, all wrapped in one. So you're back to one ID card again. It's a little bit easier for some people from that perspective. And that insurance company that you have is now the decision maker. So they are required by Medicare to meet minimums. They can't just be a junkie plan per se, but they do, outside of those parameters, get to decide what their criteria is for something to be covered. If they're going to require a prior authorization on it, they make those decisions because they control their plan. And one of the biggest things that they do is have a network of providers. So that's the contrast. I would normally write up here, you have a network. So you got to be in network, or if you get the right plan inside of that category, there's a couple subtypes of Advantage plans. There are ones that make you stay in the network, period. They will not cover a single dollar if you go to someone out of the network. They're called HMOs. Yeah. So I try to stay away from them just because of their restrictiveness, if that's a word. They're a little bit harder to deal with from that perspective because there's some things we can't control being in the network. Or, like if you go in for a surgery, you usually meet your anesthesiologist that morning in your bed. They're ready to wheel you back and you didn't have a chance to shop that person. So that's one of the best examples for why that's a concern for me. Although, if you're happy with it and, you like it, I have people in those types of plans, but they make me nervous, I guess would be the way to put it from that perspective. And then there's also PPO plans, the other type, that main type that lets you go out of network or would provide coverage in this anesthesiologist out of network example. But you're going to pay a lot more for it still. So you don't want to go out of network, even if you have one that lets you. So the network always matters with an Advantage plan. So we've got to go through every doctor, every hospital system you might like to go to, et cetera, and make sure they're in those plans that we're looking at, you're looking at if you go that way.
We've even come across that with our county policy on anesthesiologists billing out of network and not having a choice about it. Because Lisa had a surgery, well, two surgeries, and finally stood there and demanded that they get an anesthesiologist in network, and they said, we don't have anybody. But then the head anesthesiologist said, I'll do it for what the insurance pays. So even Marion General Hospital is out of network. Well, it was at the time.
For that doctor treat.
For that.
Yeah, it's a really common one that they outsource for, they'll bring in like a doctor's driving down from Fort Wayne to be the anesthesiologist for the day or wherever.
Well, not only that, they got Summit Radiology. Marion General Hospital is sectioned now.
Yeah, great example. Thanks for sharing. It's a common one that we see a lot. So I always like to use it as an example. So that would just, if you go with the Advantage plan, I would always argue for the PPO type so that at least you have coverage for that anesthesiologist in that type of example. Let's see. So I mentioned it's all wrapped in one plan. So we've got all these boxes checked already over here. The Advantage plan includes everything, all wrapped in one plan. So you've got all the coverage you've got on the left, just in a different way. The costs are totally opposite. So I've got cost on the next screen coming here soon, and we'll go over that. But we're just talking from a coverage standpoint first. This already includes the drug coverage wrapped up in it. So we still pick it the same way. Part B is still structured the same way. It's just embedded in that plan. It's already in it, wrapped up in that same plan that you have. And then I think last thing to mention here is that the Advantage plans have extra benefits included in them that you don't get on the regular Medicare side, and that's what they will run most of their advertisements about. So anything you see that's like, it includes dental or rides to and from the doctor or, healthy groceries or whatever. They come up with new little kind of fluff stuff, if you will, every year and add on to that. It's always going to be an Advantage plan anytime you hear any of that stuff. Medicare is so stripped down, it doesn't even cover drugs. You have to add every little thing you want. So we're just drawing another box down here and writing dental and vision, perhaps, for example, if that's probably the most common one that comes up. If you go this way, you don't have dental or vision yet. You can add it if you want to. Keep it from, an employer plan or whatever, is available to you, or go without it. I guess I would word it like Medicare doesn't care if you have dental or vision coverage. There's no enrollment period for it. There's no penalties for it. So you have a lot more flexibility on that side of things. But on the right, you're going to have some of that wrapped up in your Advantage plan. So that they can beef those up a little bit. We have to be careful about how much dental or vision it is. It's usually more preventive in nature and not a very comprehensive plan, although some are. It just depends on the plan we're talking about. And you've got to go to one of their dentists that they say is in that network, for their dental network. So a lot of people just choose not to use it sometimes because they don't want to go to wherever, Aspen Dental or something, just first name that pops in my head. So it still is worth noting that it is above and beyond Medicare on those extra things. All right, I'm going to try to see if this works and lets me move on. Oh, that's muting and unmuting me. Okay, this will work. That's different than the screen looks, but that's okay. I'm skipping ahead to the cost screen because we got jumbled there a little bit. This is a little different than it looks. I'm not sure what's going on with technology, but it gets the point across, and you have it in your packet too. So the costs on Medicare depend on which way you go in that chart. So I've mimicked this to have those two columns like we were just looking at. So first on the left, if you go with that first path that we talked about with the Medicare supplement and the drug plan, you'll see those costs on the left here as well versus option 2 with the Advantage plan costs on the right. First of all, original Medicare, A and B are exactly the same again, no matter what here initially. So Part A is a $0 premium if you have paid into Medicare taxes and qualify for that. So it is possible that people don't have enough work history or whatever the case may be. So you see a footnote there, there's a little asterisk on it that Part A could cost you money, but it's pretty rare. I just included that to be thorough here. And then Part B has a standard premium that Medicare sets for the country. And I've added, this is all 2024 numbers as well, I should mention. They were recently released to us, so I went ahead and included those numbers. Did I mess you up?
No, I just wanted to make sure you were good. You said it looks like different on the screen.
I think so, it's okay.
You should be able to do everything from your laptop. It should grab it, but if not, I figure
It's all the info at least.
Okay, so you got that.
Yeah, thank you. Appreciate you.
Sorry for the intro.
No worries. So Part B is standard premium in 2024's $174.70 per month. This is the standard premium, so there's a footnote on this one as well. Part B is technically income-based in how they bill it. The standard premium that I'm telling you here is what most of the country pays for Medicare. However, if you're at the low end of the spectrum of income and you qualify, the government will reduce that premium for you. And at the other end of the spectrum, if they consider you a high income earner and they have income brackets, depending on how you file your taxes and everything, you could pay more for Medicare. So I'm just gonna use the standard premium for now because that's all we have to go off of at this time, and hopefully that's what you would receive for it. Social Security would mail you some information, or you're welcome to talk to me about what those income brackets are if you're concerned about it. And so that's the same on both sides as well. So I'll finish with the left side first. So you have Part D, and that's your drug plan, remember. I've just got to put estimates on here because I don't know your drug list and everything. It's going to be different for everyone, but just to give you a good estimate, I think the probably averages about $25 a month. So that's what I put on there. They have a $0 plan next year. So it could be anywhere from $0 to $100 a month. But I think 20 is a good average number to give you for now. And then I've included an estimate for Medicare Supplement Plan G, Medigap Plan G. It's just one of the supplement types that you could choose. It's the most popular one and the best one that you can buy now. So that's the one I've included here. And we're looking at about $130 a month. And again, rough average because it depends on the company that you pick, Anthem or United Healthcare or whoever that is, they all get to set their rates however they would like. So this is a pretty good number for what I'm seeing for 65-year-olds lately for last couple of years. So in total, you've got all these different pieces that together equals something like $320 a month or something like that. So that'd be your total premium after it's all said and done to consider with that option. And then the out-of-pocket costs that you get with that are the best part about, or one of the best parts about that left side of the chart. So we didn't get to talk costs yet because I saved it to this piece, but costs are certainly the other big difference in the two options that you have to go with. So on the left here, you pay more in premium because you're paying for that Medicare supplement plan, but all you pay out of pocket with that Medicare supplement is the Part B deductible. That's it. if you get supplement plan G, so this is specific to this example, with G, literally the only thing you pay out of pocket is that one deductible. Next year it'll be $240 for the year. So it doesn't matter how many different doctors or surgeries, it's an annual cap on your medical expenses. And I say medical because prescriptions are separate. Medicare treats drugs like they're on an island. Your prescription copays are not included in this figure, but everything else is. All your doctor coverage, all your hospital coverage, everything is capped out at the $240 deductible. So that's literally the max you would pay towards medical expenses next year, if that were the plan that you had. So that's really the beauty of the Medigap plan, the Medicare supplement. Even alternative ones, we start to make some changes, but the point is that your out-of-pocket is very low. It doesn't matter if you're in the hospital every day, all year long, 240 is your cap. For next year, Medicare sets this every year for the country, so that's the 2024 number. And then the drug copays vary. I can't really say to a group of people what those are going to be because they're so different for everyone. We talked a little bit about that already. Could be $0, could be $100 copay. I just don't know without looking at those drugs for you. And that's the summary of the left side there. So you've got your premium and then your out-of-pocket costs to think about. And on the right side, if you went with an Advantage plan, again, the initial pieces are the same. And then you just have your Advantage plan enrollment instead of multiple. You just have one enrollment into the Advantage plan. And I put an average of $15 on there. A lot of them are $0 premiums now. And that's another advertisement light bulb signal to you. Anytime they say it's a $0 plan, everything's zero or whatever, it's an Advantage plan advertisement. They have a lot of $0 plans. There's $10, $20. So I'm just giving you a $15 rough number. So that makes your premium only $190-ish on this side of the chart. So we compare, that's less. And that's really the advantage of where they got that name. It's low and upfront costs. So you aren't having to write a check for another 100 and some or whatever every month just to have the coverage. But nothing's free, right? Instead of paying it in premium, you're going to pay it in out-of-pocket cost instead. So that's arguably one of the disadvantages of the Advantage plan is that you pay constantly out of pocket. You get, I was going to say what a lady said to me yesterday, put words in my mouth. You get nickel and dimed on the right, if that makes sense. Every time you go, you pay a copay for every single little thing you need all the time. Now, your plan could have a $0 copay on something, perhaps like a primary care visit, maybe. That's probably a common one. But, it goes up from there, of course. Just some examples, it might be like a $250 copay to take an ambulance ride, or, $90 to go to the emergency room, and $200 for the MRI they give you while you're at the hospital, et cetera. So there's a copay for every line item thing. And you would know what those are when you're looking at the plans. They have a full benefit summary and you can really, that ahead of time. But the point is you pay the combination of whatever happens to you first that year. And you do stop at an annual out-of-pocket maximum again. So this feels very much like a regular health insurance plan that you would have, from an employer previously or what have you, where you have that insurance company, whoever it is, that sets those copays for you. That's the boss in most senses of the word. So down here, I've just listed copays vary because, I can't really list them all. It depends on the plan. But the big thing is the annual max out of pocket to pay attention to. That's the ultimate exposure, your risk each year on this side. If you have a really terrible year and you have a lot of expensive procedures, ultimately you do stop at whatever the plan's maximum is for the year. And they're typically more in the $5,000 range, something like that. So I put $5,000 to $10,000 here. because if you go out of network, it's a bigger bucket too. It went, back to that conversation, so it could really be thousands on that side. It just depends on the plan. So they're opposites in a lot of ways and how those costs pan out for you. So to recap, on the first option, the point is you pay more upfront for the peace of mind, perhaps, that your out-of-pocket's very low. Flip that on its head. Over here, you save more money upfront, but then you pay copays all the time. So it's just kind of like you're going to pay it ahead of time in premium, or you're going to pay it on the back end as you receive the care and copays. So that's everything I had for you guys. That should be the end. Happy to take questions.
Yeah, I have a couple questions.
Yeah.
I'm on my wife's insurance. I work part-time.
Mhm.
So I'll be 65 in January. And she and I have been having these discussions. She's talked to their insurance people. They say I can stay on her plan as long as she's still working there. They also have like Medicare, I think Part D, they have that. But my question was, since I'm not an employee, or haven't been an employee there, if I did go on that, chose their Medigap, would that still be available, or would I have to get another one? I think I would have to get another one. But I know you can't answer that question. I don't.
Yeah, that would really depend on what they allow on that one. So if you, no matter what, are eligible for it, if they have a retiree supplement, Medicare supplement, it sounds like.
Yeah, they do. But they're getting ready to change their insurance too, so that may change. I don't know.
Yeah, so they should, I would assume so. If you're eligible for it based on her employment, then I would think you're eligible for the Medicare plan based on her employment, but I am making an assumption.
But she's telling me to wait, and I said, I don't want to get hung out to dry because I know it takes like 3 months
Mhm.
to get it, but then I guess a couple other questions I had is, if I do wait, do pre-existing conditions enter in, like for the plan, the G, for that? I mean, to where they can say, well, no, we're not going to cover it.
Yeah.
If I wait.
Good question. So, first of all, can I speak generally first, and then we'll come back to you because you've got some different options there. It's interesting. When you're new to Medicare, every single option is guaranteed enrollment to you. No questions asked. You could be on your deathbed and they have to accept you. And then moving forward from that point, it depends what you do with your coverage and until you get to that point. So that's where you've got some different, depends on answers there. But annually, Medicare has their open enrollment period. It happens to be right now, just once a year, that everyone gets the guarantee, no matter what, again, to do any new plan enrollment that they want to, except a Medicare supplement plan G. Not just specifically plan G, any of the Medigap plans that they offer. It's only guaranteed to you. That one is the oddball out. The Medicare supplement Medigap plan is different than all the other ones. It's only guaranteed to you when you're new to Medicare, or if you have stayed on your wife's plan for a while, you've maintained that coverage, they will let you transition later, whenever that
I
transition
know
happens.
there's a word that I know their insurance person mentioned. I was going to call it by cadence. Call that word. But it was something too, like a transition type of.
Yeah. So if you stayed on their, if you stay on the employer plan, any employer plan, until you're whatever age, 70, because you've maintained that plan all that time, you have a loss of coverage that gives you that
So
guarantee.
then it'd be just starting once, say I'm 68 and I decide, okay, now I'll go ahead and go on Medicare.
Mhm.
Then I'm just starting.
Yeah, then your transition's just happening at 68 instead of at
Well,
65.
that's what she kept telling me, but she said, will you trust what I'm saying? I want to hear it from somebody else.
Got
Not that I trust you.
it. Also, one more thing, if I can add, your guaranteed enrollment is also, there's a couple of different ways we can do it. It's also tied to your Part B effective date. So a lot of people will get just Part A because it's the $0 one. Let's say if you're working till 70 or whatever, someone might choose to keep Part A because it doesn't cost them anything anyway, and wait for B, defer B till later,
Okay.
because enrolling in that gives you
Well,
the
I guess
next
another
year.
question, they have an HSA. I don't, will that affect that?
Yep.
You know,
So
that,
that's
because that was another thing, so.
that is perhaps a reason to not do A at all. Anytime, anytime. Yeah. No, you're okay. That's
Yeah,
fine.
I mean, you didn't see what's, well, I guess one other question. Do you, like, and I mean, you personally, do you accept anybody to come in and talk to you regardless about Medicare?
Yeah,
Okay.
yeah, sure. You're welcome to, my information's in there, but I can give you this to start.
Yep, that'd work. Well,
the
doctor's office, not too far from here. Yeah, see.
Okay, so what you were saying about Medicare, okay, he's retired and he gets Part A only, but he's on my county insurance. So later on, let's say when I retire, can we both go to Medicare then?
Mhm.
Okay.
You'll,
Can I go now?
Mhm.
Okay, and the reason I asked that, our county insurance doesn't cover a CGM, continuous glucose monitor,
Mhm.
because I got stuck with a $2,000 bill because of our insurance plan. And, I just need to know how much Medicare is gonna pay for the CGM, because they will.
Mhm.
Yes, sit down and talk to someone.
Yeah, we can take this offline too. I'm happy to talk with you anytime, but they do cover them.
Yeah, I know.
And it's covered as durable medical equipment under Part B
Right.
as an outpatient service, believe it or not. Even if, wherever you get it from, or if a vendor mails it to you or whatever, that's how they would bill Medicare. And there are a lot of, or particularly one that I like, oh heck, diabetic supply companies that will work with you to bill Medicare for you, because a lot of people have trouble with that. Like insulin is another one that can be billed under B or D, but the pharmacies only know how to bill the drug plan because that's what they fill. So they have an issue billing B, and they won't do it very often. So one of, a diabetic supply company is an expert of that. So I'm happy to tell you more about that when the time comes. But that should look pretty good under Medicare for you if you go with the supplement. I mean, either way, but because that's the most you would pay for the year. It does.
$505 total out of pocket.
$240.
240, but the other 300 and,
You adding in the premium too?
yeah,
Yeah. That's your
Not per
monthly.
month.
But that's per month, right?
Mhm.
yeah,
Well, 330,
the
okay,
330s per month.
month. The 240 is a one time.
240 per year.
Right, okay.
Yeah. So, yeah, perhaps Medicare would look good for you for that, just specifically for that reason even. But you can, because of the setup that you guys have, whenever you want, you can transition to Medicare. Your first step is to apply for B, and that triggers the rest of the guaranteed enrollments for you. So that's ideal from my perspective. We don't have to use the loss of coverage from the county. It is, well, Social Security still uses it. So what you would do, it's actually paper forms, believe it or not, in this scenario where when you already have A and you just want to add B, that I can give to you. It's their Social Security forms, but I download them from their website all the time. And you just have to bring it in to work and they sign off. Social Security just doesn't take your word for it. They want the proof, that employer signature that you are X person and you have had coverage under the plan, and it's a pretty simple form, their signature, and that gets submitted to Social Security, and they will mail you a new card for B, or with both of them on there,
Because
A and B. So your card should say A only now, and then they would give you a new one that had both on there. And so then that, from my perspective, is a good scenario, because then I don't have to worry about the employer side of approving anything from the insurance company perspective, because they only go off of the B effective date that you have. So
would you be able to tell us with a list of meds and with my list of medications, which are little luminous, the cost of that coverage too? Because you say it could be, I'm gonna spend $25 for the plan, but if I do have meds that are not covered under that plan.
yeah, that's just an average plan premium. It could be $100 plan that's best for you. And all the copays are different with each plan. So I can certainly look that up for you if you wanted to know that before you pulled the trigger on,
Because we actually only pay out of pocket what you pay for the family, we're figuring our family land in there, and it may be $40 total a month.
on your drug copays. Okay.
I believe my needles are the largest, which are, yeah, that's one on there.
Yeah, we can. I would say, the best quick answer I could give you would be, generic medications are gonna be fine.
Fine.
The concerns really, let me rattle off some names to you. Ozempic,
Ozempic?
or Eliquis,
No.
or, just a couple of examples that I would say are gonna throw a wrench in those copays for you, but it's like metformin and,
I don't
you
know,
know,
I don't take it.
a blood pressure pill and a cholesterol pill.
Oh, I take all of them.
All those are not a problem, from a copay perspective. So I just have to look at it for you.
Bring the list.
Yeah.
With the insulins I take.
Yeah, you guys are welcome to even email me a list and I can look it up and get you a quote back or whatever. Or you're certainly welcome to come in and meet with me too, but I just wanted to offer that. If you just need an answer of, what are those drug costs, I'm happy to get that.
Yeah, we can find you what you guys are, most cost
Cost
effective.
effective
Yeah.
because I want the CGM back. I mean, my
So
insulin.
we're gonna do this,
Yeah.
because county will cover.
Yeah, I know. That's what I want.
Yeah, so usually when you have coverage that is good, like the counties, it's a big employer and it is good in the grand scheme of things. There's a lot worse out there. The medical out of pocket on this path to Medicare is usually way better. But then the drug copays can be a little worse sometimes. It just depends on those drugs. Medicare doesn't do as good on the expensive brand name drugs. That's really the one thing that's the kind of a struggle point. So, yeah. Hi, guys.
How are you?
Good. How are you?
I just turned 65 last Tuesday.
Happy birthday.
This is all just being so confusing to me.
Clear as mud, isn't it?
Yes. It's still confusing. You explained very good, but it's still confusing. But am I gonna be, I haven't even called, I called Social Security and talked to them at one point and they acted like they didn't want to talk to me.
Are you on the county's plan?
Yeah.
Okay.
So, do I, should I be on Part A now?
You can be, so you can still make the choice. You haven't done anything wrong, missed anything, you're just fine. You can, as long as you keep working at the counties, again, stay on the county plan as long as you'd like. You're not gonna cause any repercussions for yourself per se. But you might want to go on to Part A because it's if it doesn't cost you anything. And you can still do that enrollment with them anytime, for the next few months. You have your birthday month and then 3 more months to do that for the first time, that is. So you can still, and I gave you those application options to get with Social Security. You can even still do their online application if you want to. You're still within that initial enrollment period, we would call it, tied to your birthday.
All right.
So, you just only want to do A though. You know, they're going to ask you that question. Do you also want Part B? And your answer would be no, because you have county plan and you don't need it yet. And you can go on to B whenever the time comes.
I'm looking at 2025 to retire, but,
Neat. Cool.
so, okay.
Yeah. So, whatever makes you more comfortable. You are not required to do any of it, believe it or not. You can just, as long as you have other coverage, pass your birthday by.
I remember hearing things in the past, like my grandmother, she didn't sign up for something, and then when she went to enroll in it, they penalized her for it at that time.
Yep.
Because she said she was told she didn't need it. And then she found out she did need it, and,
That's too bad.
but, I just don't want to get penalized for anything.
Yeah.
That's the thing.
So that's where the county plan is coming in and saving you those possibilities. So as long as you don't have any disruption in the county coverage for yourself, you maintain that. If at any point it's gonna end for you for whatever reason, you go part-time and they take the coverage of, whatever happens that you're not gonna have that coverage, then you need to do something. But until that point, as long as you stay on the county plan and you just keep an eye on that, you can do that as long as you'd like, you're fine. I would say the easier thing to do is go ahead and add A, because it makes your enrollment later in 2 years easier.
All right,
It just sets you up better. And if it's free for you or premium free for you, then it's kind of like a might as well thing.
yeah. All right,
Brenda, I have a,
you have a,
and I'm still on the county thing when I started working for the county.
okay. It's just, I just kind of, I don't know, I'm just kind of a little bit afraid.
Well, it's all brand new.
Yes.
But, I mean, I signed up through online after she gave me the website and it was all fine.
It's pretty straightforward, don't you think?
Yeah, oh, yeah. I mean,
I've heard my cousins have said that it's pretty easy online.
Mhm. It's what I would do if you're comfortable with the computer at all, like even half comfortable with the computer. I think it's easier because then you don't have to waste a day of your life at Social Security or on the phone with them.
You go to Social Security and it looks dead back there. I mean, it just doesn't look like anybody's.
Yep. I'm happy to chat with you on, to have the conversation again, same spiel again, if that will help you get more comfortable. Whatever you.
I think I'll just try and go online. I won't be able to do it tomorrow, but maybe Thursday, Friday, find time to do it.
I gave you the website in there. That's just Social Security, ssa.gov. And right on the main screen, right in the middle, it says apply for Medicare. And you click that link and just follow the, if you want me to email you some step-by-step instructions, I could. But that would
probably help.
Yeah. Can I give you my card and then I guess you could email me if that works?
Sure.
Is that okay?
Sure.
And just say, hey, will you remember me from today? And then I'll send you that stuff.
All right. All right, thank you.
Yeah, you're welcome. My pleasure. Bryce, what's going on?
Oh, I'm still gonna be working for the county. So, I just came to see, if there's any changes.
Yeah, cool. Good to see you.
Like that. I've worked on road registration, we've been busy.
Have you? I bet. It's coming up.
Yeah,
Coming in strong. Not much changes except the 2024 costs, I suppose. And there, it's on the last page of that packet, that you got a copy of the PowerPoint slides, but it will be $0 for you on A anyway. Stay the same if you qualify for that. And then, so none of the rest really matters right now, but they did increase the premium, like $10 or whatever for Part B.
okay,
It's gonna be 174 instead of 164 or whatever, so,
okay.
other than that,
Whenever I get to, it's not plan F anymore, I can't do that, right? So I'm gonna do the G, so it's gonna
Yeah.
cost me 174 if I was doing it January 1st.
mhm,
And of course, I'll do the drugs, but that really depends on what my prescriptions are at the time.
yeah, could be, actually, they're rolling out a $0 drug plan next year. One of the companies is, so it could, 25 is just kind of an average number. It depends on when we look at it together, which one results is the best for you.
Okay. And then so the plan G is about 130.
Mhm.
So,
That's what I think is a good estimate to use for G for now. It is age-based, that's one of the big things that determines that premium. So I'm saying about 130 for a 65-year-old. So it just depends on how long it is until you transition to Medicare, but I would think that's still a good estimate for you to use.
okay. And then, so you got a 240 out of pocket.
Yeah, so then the one deductible that you pay with G, if that's what you get, is that next year it'll be 240. So that went up a little bit as well.
Okay.
Medicare tells us what that is for each new year. So that's 2024's deductible. So that's all you pay out of pocket for all the medical stuff. And then you still pay your drug copays, whatever the drugs are.
Okay. And your monthly.
And then the premium. Yeah, this is just the out of pocket here. And then the premium kind of estimate for you.
Okay.
Yeah.
Why do people take an Advantage plan? What's
There's pros and cons to going each way. I think for people, it depends on what your personal preferences are and kind of which way you want to get yourself set up. I think people go that way mainly for the $0 premium. And it's not all zero, by the way. It's a common misconception. You still have to pay for B, but then I'm saying about 15 here. There are $0 plans. This is just an average for those Advantage plans. So I think people get
they're trying to pay the least they can.
lured in by that idea that, well, yeah, that's better than writing them a check for $130 a month or whatever. But nothing's free, right? And it's that back end piece that I think that is a little bit misunderstood, that you have to pay thousands of dollars in out of pocket. It's just the opposite.
Yeah.
You're saving money up front, but you're going to make up for it on the back end anyway. So I think that,
Especially if you're sick.
certainly. And then the problem is getting back. Maybe can't get a supplement back again if you're sick.
Because of resisting at that time.
Yeah, at that future time.
Wow.
So I think the other reason is that some of the extra, they include like fluff benefits, if you will, in the Advantage plan. So I think they just get people with the advertisements mainly that, it has you get healthy groceries on this plan or whatever. And it's like, not, to me, not that big of a deal, but I think that's why people choose it.
Okay.
Yeah.
Okay. Well, hey, thank you.
You're welcome. Help yourself to some snacks if you want some. Good to see you. Thank you. Take care.